Besides that, I know we've been talking, but this is actually a shared decision making. It's something that's important between the patient, but also their doctor. Because we have to take your values, your preferences, combine them and fit them to the medical facts, to all we know about the benefits and risks, so we can get to your choice. What I like to say is there is not necessarily always a single right plan. There is a plan that's right for you, that's right for each patient, for each family, for each caregiver. So this is where it's so important to talk directly to your physicians, because screening ends up being just a piece of that puzzle. That's what get us looking into the lungs, making sure there's nothing there that's concerning. But also your doctor will be able to explore things like smoking and smoking cessation, whether quitting might be important. So it means that, well, if I'm doing the screening, does it mean that I don't need to quit smoking anymore because I'm taking a look? Actually not. Actually, this is something that happens together. They are partners. They're not substitutes for one another. So that's why it's so valuable to make this connection, to have this partnership with your treating physicians and your treating medical teams, so they can actually help and address all of your concerns and make sure it fits what's the best scenario for you. And I like to say this is what brings a new perspective, because there's a lot of fear, there's a lot of concern of hearing bad news, of being on the receiving end of some devastating news that can be life changing. But actually, if we move away from the fear, if you go towards proactive care, early detection actually means more life, because you go from a risk of picking up something to the point where it might still be treatable, but might not be curable anymore, to the point where actually we can cure it and hopefully lead people into more milestones, more memories, and more life. And this is also very important because it's an era of hope. What I mean by that, we have lots of new therapies. We are doing better on the screening side, but we're also doing better on the treatment side. Me as a medical oncologist, I see new drugs coming out for treatment of lung cancer very, very often. Actually, sometimes 7, 8, 9, 10, 15 new medications coming out every year, which is amazing. My colleagues in radiation oncology that do radiation therapy, they see the same thing. Same applies to my colleagues in surgery. They're getting better surgeries, less invasive, patients staying less time in the hospital. So it is indeed an era of hope, where not only we can pick up things early, but we can actually treat them better. And this is totally true for lung cancer. So here to summarize some take-home points, I'd like to ask everyone, are you 50 years of age and above? Have you ever smoked? If so, did you reach this threshold of 20 pack years? If so, ask your doctor. Bring up the question, am I eligible for low-dose CT screening? Is this something that's available close by? It is covered by insurance, and your doctor definitely can help you with that. Here I mentioned that it's often fully covered, but there are other ways that your doctor can help you to get this fully covered. So definitely look into that and bring up the question. But don't stop there. Also ask your doctor about smoking. If this is something that's been going on, they are there to help. Your medical team is there to help. No one should go through this alone, being it just their screening and their journey towards smoke cessation, or on the other end, their journey towards cancer treatment. So make sure you go there. Don't wait for symptoms. Screen for your health to keep on going with this long years of life, generating more memories, staying healthy, because this is what makes the difference. And with that, I would like to thank you all for the attention. I'd like to thank Cancer Grace as well, and I'll see you in the next video.